of people over 16, that's only about 56% of the entire population of New South Wales that is protected. That means a lot of people are not protected, and we know that when we release restrictions, coronavirus, COVID Delta, will make a beeline for the unvaccinated. We know that. So we have to be very prudent and cautious about how we open up. Obviously, on the 11th of October, some restrictions will come off. But let's be clear, the lesson from around the world, Singapore, Israel, all countries that are much higher vaccinated than we are, they in recent days have had to reimpose restrictions because cases have risen alarmingly, too fast for their hospital systems, and they've had to adjust their policies accordingly. So it's great that we've got the vaccination figures we've got. We have to do a lot better to get up to where the rest of the OECD countries are. And when we do open up, the people just have to be very prudent and cautious. I wish we were at the end of this, but all the way along, from the beginning of last year, we have always underestimated the challenge, the threat posed by COVID and COVID Delta, and it's not going to change when we open up.
Do you support this roadmap out of lockdown with some of those restrictions due to ease just next week?
Yes, I think we do have to ease restrictions. I mean, vaccination rates at very high levels are a very necessary condition if we're to resume travel in Australia and around the world. But the way we need to do that is to make sure as a policy objective that we do not have an uncontrolled number of cases or any higher levels of death and disruption than are absolutely necessary. That always ought to have been the policy objective of governments. We've got to look at outcomes. We don't want 400 or more deaths that we've had in New South Wales and 60,000 cases. That's not a normal situation. And frankly, the experience is that no country can cope with very high levels of coronavirus infection just running rampant. We only have to look at what's happening in America, in the United Kingdom, to see that that policy really is very unsatisfactory. You don't want that in Australia.
And this is the challenge, isn't it, to determine at what point is an acceptable level of people getting COVID-19 and at what number of deaths is acceptable, because there are many who say we should not have any deaths, and then others who say, well, actually we need to live with this. Where do you sit in that spectrum?
Well, the reason we had COVID zero was not to have COVID zero for all time. That clearly would have been impossible. But it was to have COVID zero and then get to the highest possible level of vaccination coverage, 80 or 90% of people double vaccinated. And that gave us the best range of options to go forward. And the idea was to get to that level of vaccination coverage while keeping deaths and illness and economic disruption to the absolute minimum. So we can see that in some states in Australia, Queensland, WA, Tasmania, that's the policy they followed. And that's been better for all concerned. That regrettably was not the policy that was followed from June in New South Wales, and then we saw the problems that came in Victoria, and we're suffering through that now. So the objectives have to be keep the virus cases as low as possible for as long as possible, and even when we open up, because around the world, Delta is surprising everybody on the downside. And we know that Delta is not the end of this. The virus mutates. The virus will keep mutating into next year. And just as we didn't see where we would be a year ago with Delta, I'm afraid to say that we've got to be prudent and say we may not know where we're going to be a year's time from now. And there may be some need then to readjust the restrictions, lockdowns. All we know is that we need to have the lowest number of cases for a long time to come, and that means vaccination. It means looking at indoor air quality in our schools. It certainly means vaccinating the most marginal people still, who are not vaccinated largely in Australia, the most vulnerable communities, and it needs keeping very high and effective levels of testing and treating, isolation and quarantine arrangements adjusted to the new realities. But we can't just throw up our hands and believe that we've come to the end of this story. If we do, I'm afraid that experience tells us we will pay a pretty high price. So let's not go overboard. Let's be prudent. Let's be humble. Let's have humility and realise there's a lot more to go as we try to get on top of what's going on with COVID in the world.
Yeah, sage advice indeed. We'll have to leave it there. Bill Bowtell, adjunct professor at UNSW and strategic health policy consultant. Thanks for your company.
Thanks, Dean.